I do see a lot of osteoarthritis in my cats that people have no idea is going on. And then when you question them, they go, yeah, now I think about it, they're not really getting up on the cat tree as much. They're a little more hesitant to come up on the bed. And exactly what Dr. Gabe said, cats, they really don't like to show their signs. Hey everybody, welcome to Paws, Reflect and Heal with Dr. Randy Pet Vet. We're really excited today because we're going to talk about a subject that doesn't get talked about on our podcast quite as much as I'd like, and that's our cats. All of our feline owners, if you see this or hear this, make sure you pass it on to your other friends who have cats, because I've got kind of one of my favorite people and one of the best cat people in Tucson, Arizona, maybe ever, Dr. Gabe Benitez with me. And he's got a few cats of his own at home, but I'll let him tell you a little bit about himself while we're getting started here. Gabe?
All right. My name's Gabe Benitez. Been a vet since 2016, graduated from UC Davis. Before that, I started working in clinic here in town, Broadway Animal Hospital, when I was 18, 19. Was a vet assistant up until leaving till vet school. During that time, for about 8-9 years, ran my own individual nonprofit for rescuing kittens, bottle feeding, finding homes, and stuff like that. Subsequently, I have quite a few leftover little guys from that didn't get adopted. So,
tell our listeners how many people are at your house. How many felines are in residence with you now?
So far, 16.
16.
All of them, most of them, pretty up there in age.
Yeah.
Since it's been so long since I taken in a little one, but yeah, it's interesting living with all of them. Definitely lots of different personalities, and we'll get to that with cats in general in a little bit. So,
sounds good.
Yeah.
Good. And we're very fortunate here in Tucson because we were able to open up Feline Focus, which is right there, and this is a cat-only practice where we don't have any dogs present at all. Actually, we make a really big point of not even bringing dog odors into the area if we can. And it's just been a godsend. I mean, that new area has really been fun,
Yeah, it's helped a lot. Big difference with cats that we've seen on the other side where everything was mixed together. They weren't very cooperative, but coming here, with the benefit of pre-medications, they seem to love it a lot. A lot of it exploring. They like the big windows, seeing the birds outside. Definitely facilitates getting a good exam and stuff done for them. So definitely a good thing that's happened.
Yeah, we're excited. So we do things like warming towels in that room, scratching posts. We do have Feel Away, which we'll talk a little bit about, which is a wonderful pheromone spray that you also could utilize at home. And I think it's really, like you said, it's amazing to see kind of the difference. I think I have ongoing cat clients who have come, and their cats are definitely different. I mean, they're definitely more laid back and more comfortable, and it's very exciting for us to be able to have that. So thank you for all the help on getting that going and being a part of that.
No problem.
So we should talk a little bit about cats themselves and kind of how they're different and what they're. One of the things that people ask is how many cats are there in the United States? And I think they've now recorded over 90 million cats. And in our world, and we'll talk a little bit about this, but in our world, our practice, which is a very busy practice, sees about 80% dogs and about 20% cats. And there are a number of reasons why that happens, and we're going to probably talk about that a little bit too. But the most common specific breed is domestic shorthair, which basically is kind of like more of a mixed breed. Would you say?
Kind of Heinz 57 little guy that usually, tabby-ish kind of thing.
Yeah, but then we have Persians and
Maine Coons every now and then.
Yeah, Maine Coons and
Devon Rexes
and I guess Ragdolls now picking up in. So we have a lot of breeds that are now out there, and people really like their cats for individual reasons. Gabe, what do you think people have cats versus dogs? I mean, now some of us have both, but what do you think a lot of times people fall in two categories. They're dog people or they're cat people.
Yeah, it depends on, I think, on living area. Cats definitely can be totally indoors, bathroom inside, food and water, that sort of thing. They do benefit from seeing stuff outside, even if they're only indoors, but maybe a little bit better that way, as long as they're not, any underlying medical issues causing inappropriate urination, defecation, things like that. Otherwise, they have quite a variation in personalities. Same thing you get with dogs, but I tend to find them to be a little bit more cuddly, snuggly, like climb on you, want to, love on you. As always, there's the outliers that don't and don't want to even see you.
Sure.
But yeah, just a little bit more cuddly, and I don't know. Dogs I see usually, and this is my own personal bias, of course, being outside, running, walking, that sort of thing, which is great and would be good for my belly.
Yeah.
But maybe not as adaptable to being indoor only, so apartment living, stuff like that.
Yeah, and I think also their basic independence. Cats are very independent animals, and so even though they're my cats will come and love you and be on you and stuff like that. One of our cats, Flash, has to be on her terms. If I move her or want to do something with her, she gets really upset and takes off. But our other cat, Batman, is really cool about that, and he just kind of hangs out. But that independence is what a lot of people seek, and I think people that basically like travel or do some things. I mean, there are positions with cats that with automatic feeders and waterers, you could leave for a day or two and really not be in a situation where you have to worry about boarding them or have somebody watching them or so.
Yeah.
One of the things you mentioned too, which I love, is cats really do like exposure to fresh air and sunlight. And there is a huge problem with outdoor cats, especially in our area, because the predators are so intense. I mean, we've got hawks and owls and coyotes and other wild cats. But we do have people here that do outdoor cat areas where they'll all be screened in. And then I have some clients that actually teach them how to walk on a leash.
Yeah, and that's definitely like a good compromise of both. Feeding what they need, but also keeping them safe is going to be one of the bigger important things. And to add on to the problems with the predators and things like that is just infectious diseases between outdoor kitties, keeping them all safe and fighting, and for sure keeping population down. Also a good thing.
Sure. No. So, I mean, I think I saw a statistic recently that indoor cats live on average 12 to 15 years, outdoor 2 to 5 years. Yeah. And it's all about exactly what Dr. Gabe said. It's infectious diseases and predators and things that are not great for them in the wild. And certainly in our area, that's really tough. So I mean, those are kind of some cool things. I think let's talk a little bit about, the statistic about how we don't see as many cats in our practices, and there are definite reasons that that would happen. I mean, that we can look at to basically talk about that. I think maybe one of them is maybe also is what the kind of misunderstanding of owners on getting their cat to the veterinarian. Basically, we should talk a little bit about kind of why I think there's less likelihood that a cat owner would come to the veterinarian unless there's really an issue. Right.
Beginning kind of like what you're leading into is that they hide a lot. They don't show signs of pain, even with, if say it's just older kitty. Arthritis, both species experience it. Partially, I think they're able to hide it better because they're generally smaller than, bigger dogs, especially Great Danes. They'll go down quicker due to arthritis compared to little Chihuahuas and cats. But they're good at hiding it even if they're super duper painful. Kitties with dental disease, they can have awful dental disease and they'll still eat and crunch all that dry, yummy food without a problem. So without, having any sort of, veterinary training where you go and you look and open things up and feel things and kind of do range of motion, it's really hard to tell. It's easy to miss. Yeah. Which I don't blame pet owners because they don't, they don't work in the vet field. And, they don't know to go looking for these things. And sometimes it's just they wait to, not they, the owner, but they, the pet, wait to show signs until it's really bad.
Yeah,
And then it gets difficult to kind of
and that, and as our practice is very proactive, we want to make sure that some of these things get caught, because early on it's an easy fix. Later on, it may not be. And I think there's obviously some hesitance on cat owners, the cost of the vet visit, the stress of getting their cat. That we'll talk a little bit about, maybe some tips on helping people to do that, getting their cat to the veterinarian. But because we do integrative medicine and I do a lot of rehab here, I do see a lot of osteoarthritis in my cats that people have no idea is going on. And then when you question them, they go, yeah, now I think about it, they're not really getting up on the cat tree as much. They're a little more hesitant to come up on the bed. And exactly what Dr. Gabe said, cats, they really don't like to show their signs. I always tell people they show that they're sick in the wild, they get eaten. And they've retained some of this, in the home situation. Yep. But one of the things that I really tell my cat owners, and I'd really like to implore on the people who are listening to this podcast, is once yearly vet visit is really a good idea. And when they get into their senior years, when they're, let's say maybe, 10 or so, twice a year is even more important, because 1 year for them is what 5 to us a lot of times.
Something like that.
And we don't want to miss it. I mean, like Dr. Gabe said, the biggest cause, for example, of urinary tract infection could be dental disease. And if we get it early, we can avoid that, or even complications with other organs. So it does become much more important to kind of get to see them.
You bet. And there's different steps. Even if we can't fix it, there's management things we can do to get it to slow down, or at least make them more comfortable while whatever's going on is going on.
Yeah. What do you think the number one thing that maybe you see, let's say, older cats for is? Do you have a feel, or are there a couple big ones for you?
Honestly, usually kidney problems, things like that. A lot of kitties tend to be overweight, so diabetes not as often, but do see that. But honestly, a lot of GI stuff. A lot of throwing up that's gone on for a while, that's gotten worse over time. Yep.
And as we're talking about this, I mean, these are definite things that if we can get on top of that, because one of the really bad complications that we're seeing now as veterinarians, that really, I don't even remember seeing it when I was younger. Maybe I was just missing it. But when these chronic GI cases go on, we get a disease called small bowel lymphoma in our cats. And it's devastating. I mean, it's a cancer that lines the lining of the bowel. We definitely think that there's some relationship to inflammation and chronic irritation. But our cats will present losing weight, not eating, vomiting or having diarrhea, like Dr. Gabe said. And catching some of these things early on, this is the goal of being proactive. We just don't want our animals to be, perfect. We want them to have a great health span, not just a lifespan. Yeah. And so we want to make them as comfortable as possible. And your veterinarian really can pick up a lot of these things, as Dr. Gabe said, that maybe not some of us are not trained to do. So really encourage you to look at that as much as you possibly can. When we talk about some of this, Dr. Gabe, I think a big hesitancy is the actual getting to the veterinarian. Let's talk a little bit about how we could possibly help, getting them here, because that's tough. First of all, and I know, I have lots of clients who call and say, I can't get to the visit today, my cat, I can't find it.
Yeah, exactly.
So they definitely hide, and they definitely know how to do that.
Yeah. So I think part of it has to be just getting them habituated, used to everything that happens on the day they're supposed to come in, because that way they're not able to pick up, this is something different, this is something new. Also not be afraid of it. So things like leaving the carrier out, putting treats in the carrier, not necessarily using carrier crates as like, punishment or anything like that. But that way they're used to it, it's a normal thing, able to get them inside, and just make it easier for them and not like a stressful event. Animals in general are really good at associating negative things with other things. So if the only time the carrier comes out is when they come in and get shots and get blood draw and then go home, then they kind of stick with that, and they don't want that to happen. There are things on our end that we do to try to make that better for them as well. So it's a team effort for sure. But leaving the carrier out, that's a good start. Kitty appeasement pheromones can definitely be a thing that you can have as a spray.
Yep.
That you can put in the carrier, and then also in the car, just so it's a nice, easy, gentle thing to add on to what we're doing. I warn people it's not usually the end-all be-all, but it's it's a part of our big multimodal plan to get them a little bit calmer.
Yes.
And then just...
I think you hit a lot of the good things, and I think when I wanted to just back up a little bit on these appeasing pheromones. Pheromones are what kitties kind of pick up when they're young. Actually, it's a chemical that they pick up when they're suckling mom. I believe that's what the company started to do. The one that's most common is called feline, and we use a ton of it. We use diffusers in our cat rooms. We spray the warming towels with it, but that's a great thing to spray on the towel, in the carrier, around the carrier, but like Dr. Gabe said, also in the car. And it's not something that's toxic. You won't even really know it's there. I mean, it's not something we pick up on, but they definitely know, and it really helps. And there are some cats that we know just have had some bad experiences doing the veterinary visit. There's an organization called Fear Free. We all get certified in that if you're interested in doing that, and we are as Feline Focused Practice is. And there's a recommendation there for a lot of times, sometimes some anti-anxiety type medication. One of them we use is called gabapentin, which is most people know as a pain medicine. It works really well to knock down the anxiety level in our cats. And we often have our owners try that and give it the night before, but also a couple hours before the cat comes. So, I think that's really, really helpful. One of the things I saw also mentioned was smart scheduling for owners with cats. Try to find a cat-only practice. Do it on a time of the day when you know that maybe the kitty's kind of going to be sleeping or kind of relaxing or something like that. So you're not kind of troubling them. Yeah.
And I mean, the other thing kind of going on that scheduling is start planning ahead. If you know your little one, despite everything you do, still doesn't like to come in and would rather go hide, under the bed or something like that, maybe feed him a treat in the front of the house, but then start to slowly close doors and kind of do things like that, so at least they don't have the ability to get to the point, which causes more stress, because then you're trying to fish them out from under the bed and grabbing a leg and kind of pulling type of thing. So
exactly.
Minimizing access to those little escape routes can help too.
Yeah, and also your attitude as as a pet parent. Our cats are very sensitive to our emotional condition. And if you're sitting there being totally stressed out and concerned and worried, your cat's going to pick up on that for sure. So I think, that's probably something that would be worth thinking about too. And then also maybe after the vet visit, really kind of rewarding your kitty, when you get home. I mean, maybe their favorite food for a little bit, or, hey, this wasn't so bad, and this is, kind of what you do afterwards. I think all of that is, like Dr. Gabe said, is part of the multimodal plan of making it more comfortable from getting them to the veterinarian.
Yeah, and that can include using Feel Away also for the next few days after, and for some kitties, especially that have stress-related bladder inflammation, using the gabapentin for a few days after the appointment as well, just to make sure we kind of keep things calm and reintroduce them back into the house in a nice, less anxious way.
So we probably should talk a little bit about health and wellness. And the first thing I think we can talk about is, what does the normal exam look like, Dr. Gabe, for a kitty?
Usually pretty similar between cats and dogs. It depends on the doctor doing the thing. I generally do mine on the floor. It's easy, it's less stressful for them. And just kind of going from one end to the other, looking at nose, eyes, mouth, checking lymph nodes, listening to lungs, heart, gently touching belly, making sure we don't feel anything abnormal, getting pulses, and then all the way to the rear end looking, because every now and then the kitty will have anal gland issues, and we check back there as well. And then usually minimize how many stressful things. If there's anything that we see that really annoys them or have in their chart that really annoys them, maybe we do that last. Like ear temperature can definitely not be a favorite of them. It's a little bit better tolerated than the old way.
Right. Yeah, we really focus on the ear temperature if we can. Yeah, it's much easier than that rectal thermometer.
Yeah, and then whatever, services we kind of go for the most important depending on stress level.
Yep. Yeah, exactly. And we do a very good job here, and our technicians are so good at this, of really assessing the stress of the cat. And, we'll have times when we would like to obtain some lab work or some blood work, let's say. If the cat's too stressed, we just call it off. I mean, it's not something that we're not going to push them to do that. It's only going to make their experience worse and coming back, harder and harder, obviously, for them. So I think we're really good at that. One of the things that comes up in the yearly examination is vaccines. And you know me, I'm a huge fan of titers. Maybe we should talk a little bit about that versus the vaccination and kind of your thoughts on where that's at.
Yeah, still close to training from school, so I still usually go more towards the vaccines.
Right.
And then just generally do kind of, for sure, if it's legal issues, you recommend that. For rabies in particular, in Pima County, we don't have to worry about that. And then it depends on exposure, on what exactly is what we need to protect them against. So in particular, rabies, we have had some rabid animals fly into the house, so I still recommend it, but if we end up not doing it, that's okay. We just have to be more careful about it, especially if, the patient's reactive and potentially bites people at home or something like that.
Sure.
Upper respiratory, I think is fair, to consider as core, and getting that on board, especially if you have multiple cats at home, or depends on what you're bringing in. If you're doing rescue, if you adopt a lot, you foster, things like that, or if you have an indoor-outdoor kitty, that changes the game a lot.
And I was going to mention one of the things that pet owners, that I've seen cat owners forget, is having an open window with a screen. And we have an outdoor cat that's now coming there and sneezing through that screen. Boom, there's your contamination. So, there are definitely multiple reasons to make sure we consider that they're up to date and they're well vaccinated. I lean a little bit more on the integrative side to doing vaccine titers. For people that don't know, I've had a couple questions on my email about that versus vaccines. Titers are a measure of protection for the cat to see if they are protected against the upper respiratory combination or rabies. And, like Dr. Gabe said, it depends on the animal's exposure. It depends on their lifestyle. Obviously, it depends on, the veterinarian's assessment on what's necessary. And I'm certainly not against vaccines. We use them all the time. But I do a lot of titers, which is a blood test. And again, that's a little bit of a problem too, because then you have to get blood to assess them versus giving a vaccine, which in our hands could probably be a lot easier than the blood draw, for sure. So,
and I think the biggest thing is kind of either way, trying to make sure that they're protected against these common infectious diseases and potentially fatal diseases. So, either titering or boostering.
Right. Let's talk a little bit about the idea of lab work and blood monitoring for our cats. Kind of talk a little bit about your thoughts as far as where that sits in the scheme of what we're doing.
Yeah, I think definitely very important. Again, exposure has a lot to do with it. Taking your typical indoor-only kitty, for sure, as they get older, looking for subtle things that subtle things that change on lab work that can indicate one of the more common things that we see is kidney disease.
Right.
Because there are points that we can step in, unfortunately not to cure, but to slow down and help manage those things. So getting before things get bad enough to make somebody want to come in, doing lab work helps us catch them at that point before anything major shows up, like vomiting, diarrhea, severe weight loss, where it's going to be a lot harder to catch up and potentially manage at that point.
Yep.
So definitely very important for that, for kidney disease. Hyperthyroidism we can sometimes catch, or at least hints of it coming on. Otherwise, good screening things now more important usually for the indoor, outdoor, or more exposed kitties that live with either feline leukemia or feline immune deficiency cats, or you foster a lot, is those infectious disease screenings along with a CBC and making sure that we don't have any obvious anemia, any obvious elevation in white cells. So all definitely important for sure as kiddos get older, doing that twice a year like you're saying.
Yeah, and I think, the thing that I've tried to impress upon my clients a lot is the thing that Dr. Gabe mentioned, and that is trending. We love to look at, when we have lab work, let's say when they're younger, and now we're pursuing a little bit older lab work. Their kidney enzymes may still be normal, but if they were averaging, let's say, a creatinine of 1, which is their main kidney enzyme, and that's been repeated a number of times, and all of a sudden it's at 1.9, that's a little bit of a red flag, like, we better look at this a little bit and make sure that we're not heading in that direction. And like Dr. Gabe said, there are things that we can do and step in, probably not to stop the eventuality of kidney disease, but also to slow down the progression and maybe the symptoms of it.
Yeah.
And the other thing that, that I do a lot of in kitties is I look at something called a pro-BNP, which is a heart enzyme. Our cardiologist here in Tucson really likes those because what pro-BNP does is indicating whether the heart muscle is being stretched more than it needs to be. And there could definitely be reasons for why that happens. But Dr. Gabe's right also, hyperthyroidism, big one when the thyroid starts to jump up. Again, not something that we can stop, but something that we can kind of slow down and head off and obviously decrease the bad signs of severe weight loss and eventually, inappetence and whatever else comes with that. So muscle mass loss, yeah. So
yeah, and kind of to add on to your comment about BNP, kitties have frequently sneaky heart disease.
Yeah,
they
absolutely.
can have a thickened heart. On X-rays you can't tell. During an exam, they may or may not have a murmur and have very thickened heart walls. So getting a BNP is also really important for that.
Yeah. You mentioned earlier about gastrointestinal or GI issues in cats. Kind of talk a little bit about what you see, most commonly, and kind of your thoughts on that a little bit, if you could.
Yeah, usually it's a lot of either vomiting or diarrhea. Some of the history might have been, okay, he's always had problems with hairballs or something like that, or on and off diarrhea off and on. But what we usually catch is when they start to have other signs like weight loss, or the vomiting diarrhea is getting a lot worse, a lot more frequent, or inappetence starts to set in.
Sure.
Sorry, what was the other part?
No, we just talked about a little bit about maybe making that diagnosis. Like, what do we, what kind of things can we look for to help the owner in that situation?
Yeah, so other than that, those are going to be the most presenting signs. But
Sure.
honestly, subtle weight changes too
Yeah.
are going to be key, and that's one because a lot of people don't have scales that they can use at home.
Sure.
So that'll be a good, once a year, every 6 months, whatever we feel, getting that weight into, looking at that trend.
Yeah.
Which can lead to, unfortunately, a lot of different things that we might do to try to figure out.
Yeah, people don't realize sometimes the armamentarium, the amount of things that we can do.
Yeah.
Some of them very non-invasive to kind of figure out, why is this cat chronically vomiting? And I remember my first, one of my best cat practitioners at my vet school would say, vomiting in a cat is hairballs until proven otherwise. But, as Dr. Gabe said, when it continues to go on and there's no obvious hairball produced, which doesn't always have to be the case, even they could still have hairball problem and not produce hair. But, obviously we worry about the consequences of weight loss and electrolyte changes and some of the things that can happen from that.
Yeah. And progression to things like you were saying earlier, the lymphoma.
Yeah. Which is kind of cool because I used to do a lot of endoscopy or fiber optics in cats, and I still do. But we can actually do a blood test now for that, and it's pretty diagnostic. It's pretty cool. VDI is a laboratory that we use, and it's pretty spot on how it gives us an answer. One of the things that I do a lot of is look at their microbiome. And people, that's a big catchword in the human world, but microbiome is all of the good and bad bacteria and yeast and fungus that are in their bowel. And we actually have a company called Animal Biome that we can test that and see if it's really out of whack. I mean, we call that a dysbiosis. This can often lead to something called leaky gut syndrome in our cats. And again, will present as weight loss and complications. But it can be corrected with supplementation versus medicine a lot of times. The other thing that I do a little bit of, and we're kind of like looking at more and more is sometimes what we call food sensitivity tests. So sometimes we get into a situation where we're dealing with cat allergies, but also it could be expressed as a gastrointestinal disease. And there are a couple companies that we can actually look at. One is NutriScan, which is a swab type kit that our owners can get online and actually swab the inside of their kitty's mouth and see, is there anything in their normal food that we should be avoiding? It's not 100%, but it gives us a little bit of something to go on. More specifically, this company we mentioned earlier, VDI, makes a blood allergy test for cats. And it's pretty spot on. I mean, the thing that was amazing, I don't think I've even shared this with you probably, but I had a kitty a couple weeks ago that's had chronic face itching and foot licking and scratching, and it's been on all kinds of medication, including steroids, and really nothing has gotten it well. And so we decided to run this VDI test on this cat, and one of the things that it came back sensitive to environmentally was mold. And so we told the owner, and the owner went and had one of the mold remediation companies come out and look. They found mold in her house in 3 places.
No way.
So she was exposed to it, and her kitties were exposed to it. And, whether that's the number one reason why this cat had a problem, but if it's there, it's certainly something you want to eliminate.
Yeah, try to look at.
So it's kind of like why we look at some of these things. It's been very, very interesting to kind of have a little bit of add-ons to some of the normal diagnostics that we can do.
Yeah.
I think, let's see, is there anything else health and wellness-wise you can think of that we didn't touch?
No, I mean, there's a lot of stuff we can definitely go over, but I think it's going to be a little bit much to try to hit everything all at once. But I think getting them in and doing the wellness stuff, getting them in, even just the exam, if we don't even think about blood work, there's a lot we can find by listening, touching, that sort of thing, and talking to people. The things that we don't notice in the clinic, less jumping up and down, is definitely something important to know, that we've been able to help with a little bit of pain medications.
Yeah. And there's some newer medications out there that we've been using with great help, newer ideas, monoclonal antibody products and stuff like that seem to really be helping our kitties. So it's really exciting. What's really exciting for me is having that cat that the owner really didn't know had a problem, and then palpating the animal, feeling the animal, and seeing where the animal's pain is, and whether we x-ray or do anything besides that, but then talking about either some supplements to help moisten the joints or give them some anti-inflammatory effect like omega-3s, some of the joint supplements, but then some of these other medications that are not going to affect their liver and kidney terribly, but may help. And then the owner coming back in 3 to 6 months saying, oh my God, this is like a completely different animal.
Yep.
And that's thrilling for us. I mean, it's one of the most satisfying things when, as a veterinarian, you could pick up something that the owner didn't quite know about, maybe became aware of after we talked about it, but then really improve with some of the things we've done.
Yeah.
Here's a big one that we always get, and I'm sure we can talk about it. There's a lot of different answers to this question is, what do I feed my cat?
Ooh, okay. So I'm pretty basic.
Yeah.
Because honestly, seeing a lot of different people and different, kind of financial situations, the biggest thing is, making sure whatever you're feeding is nutritionally complete. Usually the easiest for me to do that is looking for what's called an AFCO statement. And it'll say this diet's been formulated to meet whatever life stage we're doing. And that's going to be one of my biggest minimum requirements.
Sure.
Even if it's like a homemade diet, trying to see if you can get something that's, at least been formulated by a veterinary nutritionist or something like that.
Yes.
So that we can make sure that we're getting all the macronutrients and micronutrients into them. Otherwise, it kind of depends on how they tolerate stuff. Dry food, it's a love-or-hate type of relationship, right?
Sure.
It can be, very carby, very hard on the body. But for me, in my case, it works out great just because having to do
You had 16 cats. I mean,
16 cans
and
a
we're
day.
talking, and we're also talking about, the expense. I mean, you're absolutely right. It gets ridiculous. And I totally agree with Dr. Gabe. I tend to see a lot of second and third opinions, so I have a little bit more selection in kind of what I'm looking at some of the times with some of the diseases we're dealing with or some of the maladies. And I tell people that there's a food hierarchy for all of us. Fresh whole food is definitely number one. But like Dr. Gabe said, I've been doing this for 43 years, and I couldn't balance my cat's diet properly. When you're talking about calcium levels, vitamin D levels, these are very, very important. So there are a lot of references out there that you can look at, cat diets that have been formulated by veterinary nutritionalists. If you want to do fresh whole food, you certainly can do that. Second down for me is usually I like freeze-dried products a lot. And the reason I like that is I get scared about raw food in Tucson. We have 110 degree days. I don't know if this has been refrigerated properly. I don't know if it's been handled properly. So freeze-dried for a lot of my kitties is a great way to go because I am eliminating some of the carbs or the inflammation, but they're also getting a formulated veterinary diet. And then down from there is, like Dr. Gabe said, the better dry foods that are well formulated. They're out there. They're compounded well. We also have prescription diets. I'm not a huge fan of prescription diets, but we do use them a lot. I know you use them a lot, and they're very effective. I mean, there's a lot of research that goes into those foods. So you realize that hierarchy, you could pick where you fall in that. If you're that cat owner that has one cat, loves to cook for your animal, look at creating some diet with what you normally do. I tell people, like, Gabe mentioned this, that, canned food is like 65% water. And so you're spending a lot of money. I'd rather add that water to freeze-dried product than buying it in a can. But, it really depends. I have kidney cats that come in and people say, well, I'd love to feed him this, but he's going to only eat Caesar. Yeah. Or he's only going to eat, this product. And my answer is, that's what he eats. Yeah. I mean, you got to feed them what they're going to eat.
Exactly.
And unfortunately, cats are very specific about that.
Big time. It's a texture thing. It's a smell thing. Sometimes it doesn't smell like anything if it's a prescription food. And they don't like it, or sometimes it's too stinky and they don't like it. I've been told that. And it all comes down to treating the patient, treating the individual. And sometimes it's, it's not all a blanket thing. So some do better on dry, some like it better, some do better on canned.
Absolutely.
Just kind of
and you got to go with what they're going to go with. I mean, it's all of us here on the veterinary side can be as didactic as possible. We got to have this, or we don't want this in their diet. But there are usually ways around that, and there's supplementation that can be done and stuff like that. So I think that's really important. One thing we didn't mention was cancer. And I know all of our experience in the veterinary world is that, and you've been around long enough, not as long as me yet, but the thing is that, when I first started in practice, I mean, it was kind of a rarity. And now it's not the case.
No.
I think the statistics in cats are that 1 in 5 cats at the age of 10 will develop cancer. Kind of your same thought, or?
Yeah, I mean, I don't see it a whole bunch, but it's still out there.
Sure.
In particular, more like the GI lymphoma type of things, which, with chronic inflammation, either from diet or dysbiosis or, allergies and things like that, I can see that. And as time goes on, we're able to make these guys live a lot longer, have them live a lot longer, comfortable, so that, it's bound to come up.
Sure.
And then just being able to do more diagnostics and more of the regular wellness stuff. The VDI panel hasn't been around for very long, has it?
No, not at all.
So
a few years.
And other than that, it's always been biopsies, FNAs, and stuff like that. So we do see it a lot.
No, that's good. No, I mean, you said it all. I mean, that's and then we obviously there are specific veterinary oncologists that deal with certain types of cancer. Some of us, a lot of times, I get a lot of questions from owners. I want to be more holistic. I don't really want to be invasive and do this surgery, or I don't want to do this. And there are other options. I mean, we do things like ozone therapy. Dr. Gabe talked about balancing the biome, very important with the GI disease, especially lymphoma cats. So there are lots of options out there. You just got to keep them open. And, I want to tell our listeners, you can always address your questions to me through my website, drrandypetvet.com. Anything that you want to address to Dr. Gabe, I'll definitely make sure he gets it. But I want you to know that there's definitely help out there. And as I asked before, if you are a cat owner and you're seeing this, recommend us to your other cat friends, because this kind of information is really important. We're just talking about a lot of basics, but really we want to make sure we are proactive with our kitties and stuff like that. Is there anything we missed? I mean, we covered a lot of subjects. Anything else you could think about that you want to talk about?
I think that's a good start.
Yeah, I think we did really well, and I can't thank you enough.
Yeah, no problem. Thank you.
And I promised you it was going to be harmless, right?
Yep, I'm still alive. I made it.
It was easy. It was easy. But I think, you've gotten some really, really good information. Like I said, we'll follow up on with our newsletter that's on my site with specific questions I'll answer for you. But please reach out to us. Subscribe to the streaming services for the podcast. It really helps us. But thanks for listening today, and I hope you have a great day with all your kitties, and whether it's 1 or 16, hopefully they'll stay healthy. We wish you the best, and thanks for listening to Paws, Reflect, and Heal today. Thank you.
Thank you, guys.